At the moment, indeed, the patient has been transferred to Klerksdorp in a very stable condition. Klerksdorp is our designated isolation center in the province, and we're going to continue to run some tests today. Hopefully, we will know by midnight what the condition is, because as we had indicated, the patient presented with high fever, weakness, and cough. Then the symptoms that we saw was that of hemorrhagic fever. And we will know immediately after the tests come out what is the disease. But we are excluding Ebola because the patient has not traveled any way abroad and has not been in contact with anyone who comes from outside of South Africa. We know for a fact that this patient is a local patient, member of the community in the farming communities near Potchefstroom. That is what we know thus far. I can also say that Potchefstroom Hospital, we have uplifted the quarantine there immediately after the patient was transferred to Potchefstroom Hospital.
Let's just get some clarity on this hemorrhagic fever issue. We know that the term is a sort of umbrella definition that refers to a number of diseases that fall underneath the wider umbrella of hemorrhagic fever. We know that dengue fever, the Marburg virus, Rift Valley fever are among those that fall under that definition. I mean, are you able to say, even though he has operated locally and not been exposed to anyone traveling, are you able to say which of these he's likely to be suffering from?
Yes, there are different types of fevers that we know of. And we still maintain that the only way of getting, in particular, Ebola is through contact, as explained by National Department of Health various times. And when we look at this patient, we looked at the background. Where has the patient been? Who has he been in contact with? And it's very clear to us that there could be other things that we don't know. That is why we are running tests. And that is why we are saying to people, the chances of us talking about Ebola are very slim.
Was this patient in any position to pinpoint the source of his exposure to the fever?
Come again?
Well, was he in any position to pinpoint the possible source of his exposure to this illness?
I'm really struggling to hear you, but we don't know yet in terms of how could the patient be able to be in contact or to have this kind of fever.
Well, are you investigating the possibility that he might have already passed the disease on to others he came into contact with at home or work?
We are busy with that investigation, but also at Potchefstroom, where he was, we have ensured that we have disinfected all the medical facilities and the staff that he was in contact with. They will also be put under close monitoring to check if there are any signs that will be presenting similar to those that he has. Equally, we will continue to check with the family where he comes from if there are any signs. At this moment, we don't have any indication of that sort.
Do you have any idea when you will have the results of the medical tests you've carried out on him?
I spoke with the hospital in about 5 minutes ago, and the indication is that we would have a result by midnight today.
All right. Thank you very much for talking to us. Tebogo Lekgethwane is spokesperson of the Northwest Health Department.
You deserve to know more. eNCA.com